for cancer to survive, a lot of people think, oh, it's just the cancer itself. You're fighting just the cancer, but you're not. You're fighting the immune system because the cancer has hijacked your immune system. So then when you get, you're not just attacking the cancer, you're attacking your immune system is going to fight against you. And so you have to give the signals to convert against that. And that's kind of the things that we started finding.
This is Doctor Talks.
Welcome to another episode of the Exponential Longevity Summit. I'm your host, Dr. Jeffrey Gladden, and we're here today discussing leveraging AI to outlive disease and live young for a lifetime. And my guest today is Jason Williams, MD. He's the director of the Williams Cancer Institute. He's the author of Immunotherapy Revolution. And Jason, you and I were talking a little bit just before we got started here, and the work you're doing is absolutely fascinating. So it's a real pleasure to welcome you to the show.
I appreciate it. Thank you for having me.
Yeah, absolutely. So why don't you tell the audience a little bit about your background, maybe a little bit how you got to where you are today, and kind of launch into some things related to cancer and aging.
Sure. Yeah. Yeah. So, I guess the whole story, when I was younger, my grandmother died of breast cancer and I watched that. I kept thinking, it's like, gosh, it seems like there could be a better way. I mean, she had mastectomy, radiation, chemo, and then she was dead in 2 years. And I thought, is this the best that we can do? And I was like 12 years old then. And then, of course, it wasn't that much longer. Then I end up in college, deciding I was like, oh, we really want to get into cancer research. And it's fortunate that I got put into some programs that when I was like 20, 21, doing cancer research, particularly like in gene therapy, and we were working on P53 and doing all these mouse studies, and we did this work where we're treating the mice with these gene therapies, injecting the tumors, and getting these amazing responses. So I was like, oh gosh, like this looks amazing. I think we might be onto something big. And then I kind of watched it transition over into going into the human patients. And when they did the clinical trials in the humans, they took it and they were giving the drug intravenously. And I remember asking one of the doctors involved, I said, hey, wait a minute. I said, you guys are going to give it intravenous, but we inject in the tumor. And they said, but that's not how we do it in humans. So we give it intravenous. I said, but no, but we injected in the tail vein of the mice, which is intravenous. It didn't work. Right. It only works when you inject in the tumor. And so it's not going to work in humans. And they're like, how you do it? And makes no sense. It's
right. The mindset of this is how we do it, right? People get in their way of thinking. Yeah.
But here I'm, I'm 20, 21, and I'm thinking like, what do I know? I don't, so I asked the guy, I said, why do you not do it? He's like, oh, it's too hard to inject in tumors in humans. And so I was like, okay, great. So then, a couple of years later, I'm in medical school, and interesting enough, my medical school they're very progressive. We had like stuff way ahead. They were really like us doing like laptop computers when nobody was doing that. We were all like doing stuff on this. This was in like 1996. So one of the things that they did was they had merged anatomy to be with radiology. Like, so you did anatomy and radiology sort of at the same time. Yeah. Which makes a lot of sense.
Right.
And that was unique. And nobody was really doing that. No, normally do anatomy and do radiology. So when we did that, that was our first semester, obviously anatomy, gross anatomy. And there was a part with interventional radiology correlating. And the guy comes in, he's like, oh yeah, I'm an interventional radiologist. And this is what we do. We're like sticking needles and biopsy and stuff. I said, wait a minute. I said, you sticking some needles and tumors? And he's like, yeah. I was like, then you can inject medications in it? And he's like, I don't know. Yeah. I think if you get a needle and tumor, you can inject medication. Right. And originally my plan was to be an oncologist because I wanted to go into cancer and cancer research. I said, wait a minute, no, that's the area because that's what worked. And so I decided that I'm going to become a radiologist. And I went that direction, looking at, cancer treatments and hitting directly in the tumor. That into a lot of ablative technologies where you stick a needle in tumor, you can freeze or you can heat and destroy cancer. And we started seeing where you could do this and you would stimulate an immune response. So I could kill some of the patient's cancer and then the immune system would attack it. But, a lot of times the problem is that people do this, but they're doing it the wrong way. I mean, they do the idea where, okay, you got a tumor, you got to kill the whole thing and you need a margin and you need to kill a margin. That margin, you're actually getting suppressive immune response. And so then you mess the whole thing up. So it turns out you only ablate part of the tumor. That was what we found.
Yeah.
And
So
that-
just so the audience understands this, because we were talking about this earlier, when it comes to cancer, we always think about killing cancer. We think about
yeah,
killing cancer cells, right? What can we do to kill cancer cells?
yeah.
And really, when you work in this field, you know, long enough, you realize that killing cancer cells is only half the equation. That really it's your immune system that ultimately, when it's young, is keeping you healthy and kind of pruning cancer cells from your body and pruning senescent cells from your body as well. But as you age and the immune system ages, it loses its naivete and its ability to adapt and to attack new threats, if you will. And so really, if you're going to ever control cancer, and we're going to talk about how you control aging too, it really comes down to the immune system, which is what you're talking about. Yeah.
Yeah, I mean, it's I think our approach to treat cancer was been completely wrong. Cancer is a process that ages and ages the cells around it, and our treatment idea was to make it older, give it chemotherapies, give it radiation.
Right.
So the concept is that it's like you have a group of people and you have this old group of people and you want to get rid of them. So let's just give stuff to make everything older,
Right.
but you don't get rid of all of it. The way to cure, the way that's going with immunotherapy is make it younger.
Mhm.
You make the old group younger again, and that's kind of the concept, and that's kind of what we found, and that's what we found with immunotherapies.
Yeah. So, it's interesting you talk about making older. One of the things that we picked up some years ago was that we saw a gentleman that came in with a DNA methylation age in the urine. So we can measure it in the blood, as you know, but we can also measure it in the urine.
Yeah.
And he was in his 50s, and his DNA methylation age in the urine was like 102.
Oh,
And we didn't know what to make of it initially, right? It was the first time we saw it. But ultimately, we learned that that was associated with bladder cancer.
yeah.
Right, this idea of it's making it older, and
Mhm.
subsequently, when we test for this, we found several other bladder cancers for people simply by doing the DNA methylation test and showing that what comes out is like 96 in a 45-year-old or, this kind of thing, which is really interesting. So your idea that cancer is kind of old cells, and now you're doing treatments like radiation and chemo that is aging the cell, if you will. So you're making the old, and you're making the young old too. So what's the
Exactly.
with that, right? Yeah.
Yeah. Yeah, that's not a good way to treat it, and so, yeah, that's really interesting you guys are doing that because that's definitely, the cancers age everything around. That's how the cancer protects itself. For cancer to survive, a lot of people think, "Oh, it's just the cancer itself. You're fighting just the
Mhm.
cancer," but you're not. You're fighting the immune system because the cancer has hijacked your immune system.
That's right.
Cancer is now telling the immune system it's part of your own body,
That's right.
and it is, and, don't kill it. So then when you try to get you're not just attacking cancer, you're attacking your immune system is gonna fight against you, and so you have to give the signals to convert against that, and that's kind of the things that we started finding was that when we could get the immune system to and say, "Wait a minute, no, this is something we should attack," and
Right.
as the immune system attacking the cancer, the immune system also started attacking old cells,
Mhm.
and then the patients begin getting younger, and that was a
Yeah, so just so the audience understands, that's a subtle, almost sleight of hand right there, right? So he's using drugs at this, sort of let's call it a cocktail of drugs, to actually boost the immune system and make the immune system younger, and that is attacking the cancer, right? So now there may be some other therapies. Maybe he's injecting something, maybe he's doing something to make it hard for the cancer, but ultimately the immune system is getting younger and now cleaning out the cancer. But what he found is that it's actually making the patient younger at the same time it's killing the cancer, probably because it's pruning senescent cells in part. But you want to talk about that? Because that's
yeah.
really, really cool stuff.
Amazing and surprised. I mean, because obviously my main focus in cancer, I want to cure cancer. Aging certainly was an interest, and I kept finding myself sort of crossing over with the aging stuff, but I was really worried with cancer. And then here we are, we're treating cancer patients, and yet we're starting to see things that look like the patients are, they're telling us, because the patients are saying, "Hey, I feel like I'm 25 again," and if when they first started telling me this, I thought I think it's just because they felt so bad, and now they're feeling better that they didn't realize, and so they think they feel like they're 25.
Right, right. It's all relative, right?
Yeah, exactly.
Mhm.
But they couldn't really feel like they're 25 and think. But then you start looking at their scans, and, look, I'm a radiologist. You can show me a scan. I can tell you that person's old, that person's young. I mean, you can
Right,
look at the differences, right?
right.
And, I mean, you would see the changes, and I started seeing the scans. The patient's bodies are looking younger.
Mhm.
And it's like, that's really interesting. Then you start seeing, wait a minute, those discs were degenerative and now they're increasing in height. That that is stuff that should not happen.
Right.
And so then I was like, oh wait, something's going on here. We're treating the cancer, but yet simultaneously we're making the patient younger.
Yeah, and then I think you, as we are talking about, you had some conversations. David Sinclair published a paper where previously it had been shown that using these Yamanaka factors, these gene factors, 4 factors in the cell, that you could actually make a cell young again. You could actually start to revert it back. And in fact, if you kept the Yamanaka factors activated, you could take it all the way back to a pluripotent stem cell, right? It would lose its identification as a heart cell or a muscle cell or whatever else. And then David Sinclair came out with a paper, it's almost about 2 years ago now, where he was using 5 different chemicals to actually do the same thing that the Yamanaka factors were. Tell us a little about the conversation you had with David and how you
Yeah.
switched off that.
Yeah, and I discussed with David because it's interesting because obviously the real question is like why do we age? And David Sinclair has this theory, he calls it information theory of aging,
Mhm.
where basically the data is all there, but it gets corrupted, it gets methylated, you're not seeing it.
Right,
And if you could revert back to a prior setting, you would be younger again. And
right.
I thought that makes complete sense, actually. I mean, I think it's genius, and I think he's partially right on that. And I looked at it, but then when I looked at the agents that he's using, these agents are some of the same agents that we use, like off label. Valproic acid.
Yeah.
Tranylcyprine, which is sodium butyrate, which is found in the microbiome a lot. It was obviously sometimes we do fecal transplants and things like that to help cancer patients, and you can do fecal transplants to make people younger as well. And so, that was interesting. And then for scolin, which is a root herb that has like several effects on the immune system as well. And he was showing obviously these things were activating the genes, but then also you look and say, well, they're immunotherapies. And so what we saw on our side, and this is why it led me to realize that it was more the immune system than the genes, was that I could replace some of his agents with other agents that don't affect the genes, and they
Mm,
still get younger.
interesting.
Yeah. So I didn't have
Because
to. Genes.
because what you did, I think you mapped what he was giving back to the gene, but then what that gene was doing, like it's
Yeah.
elevating TGF beta, and so you block the gene that's making TGF beta, or you can just block TGF beta. So, for
That
example,
that's right. I mean, there's several ways that you can achieve the same,
mm,
you know, end result. And, that's kind of it's funny because, yeah, we found that, okay, you could replace them with other agents, and you could use other immunotherapy agents and boost the response more than what you would see with just the chemical reprogramming factors that he discussed. When you
right?
start adding on agents, like we have an agent experimentally I work with, it's called an anti-CD47. Now, anti-CD47 is a "don't eat me" signal to the macrophage.
Mm,
That is expressed by senescent cells to keep the
okay,
macrophages from not eating them. And so it's also expressed by cancers. Now, what happens when you do it in cancer treatment, if you do this heavily systemically, you will start knocking off some of the patient's platelets and red blood cells because you'll make them like normally that what happens when there's the age, right? They kind of I think they accumulate these complement type proteins and like barnacles on a ship, and eventually there's too much and they're taken out,
right.
by the immune system, by the spleen, and they will start knocking them off early. So then you'll drop the person's hemoglobin and you'll drop their platelets like faster than you
And
expect if you give.
produce it. Yeah.
Yeah. Say, hey, you can use it. It's a great agent, but that was the thing that they found in a lot of the studies, using it systemically at higher doses, you had sort of that toxicity to it. We don't use it that way. We use it in the tumor, so we don't have those issues because we're just killing locally, so we don't have those cross side effects from it.
That's your anti-CD47 you're injecting into the tumor. Is that what you're saying?
That's an agent that we work with a lot, and
Yeah.
it's a great agent, and it's anti-aging. And there were then they there was in we were seeing this anti-aging, and I was kept wondering, gosh, what's the CD47 doing? And then later there was a study that somebody did where they showed if they injected anti-CD47 into muscle, they made the muscle younger. So
Right.
so it's
Okay.
it's certainly an agent. I mean, you've got that. I mean, then you've got, a lot with TGF beta. So, too much TGF beta is problematic. And then you start looking at the cytokines. There are certain cytokine panels that are associated with aging, elevated
IL-1, IL-11.
1,
IL-11 is a big topic right now.
11, 6, all those are, and, and so you can look at now, one is I can tell you that IL-1, I think, is a big driver. I think if you knock down IL-1, you'll actually start seeing your IL-6 and IL-11 come down
Right.
without directly treating them.
Directly
And
treated.
there
Yeah.
is an FDA-approved drug that inhibits IL-1 called anakinra. And so, and it's interesting when you look at that drug, this drug has been FDA approved since 2001. And you think, well, why is it not used more? I mean, it's approved for rheumatoid arthritis, but it's not the main drug you use for rheumatoid arthritis.
Mm.
And then when you look at the data behind it, you know, it was the only drug to show that reversed erosive changes. It reversed the arthritis.
Really?
Why did they not use that more? I have no idea. I mean, it's expensive. I mean, that's necessarily a drawback, but all those biological agents are expensive. So I'm not sure that some of the others are that are not any better. I mean, they're probably not as good. Why would you not use anakinra? I think it.
So you're coming across this realization, and then tell us a little bit about you and your mom.
Yeah.
So you started doing some of these, taking some of these drugs yourself to sort of figure a few things out, and then I know your mom got involved with this too. So just walk us through that a little bit, if you would.
Yeah. So I mean, one thing is that my mom, she really hated getting older. I mean, she's
Yeah.
basically like she's 79, almost 80, and so she just really didn't like it, and it was really just getting her down and depressed,
Mm.
and I felt like I needed to try to do something about it. I knew that I wanted to do something about aging, and I was afraid that if I didn't do something faster, it would be too late for her.
Yeah.
Um, so as I started putting these things together, I was like, okay, look, I think I'm getting enough that I can move forward. And I had the discussion with my mom. She's like, look, she's like, if you got stuff that makes people younger, I'll try it. I'll be the guinea pig. And initially I was like, okay, I'll do it. But then I was like, no, but I don't want to do something unknown on my mom. and,
Right.
and I mean, how am I going to live with myself if there's a problem? So I
Sure.
decided- I was like, you know what? I'm going to do it myself.
Okay.
And the other thing is that I needed to adjust dosing because
Right.
there were some unknowns on how you would do the dosing. And for me, the better way to do it was to do it and to feel it and experience.
That's right.
And that,
I'm on the pointy end of the stick too, I call it.
yeah.
Well, I'm not going to recommend anything to somebody I haven't tried myself. So
Yeah. So that's why so I had to do it and tweak it, and that's what I did was, I did it and started figuring out dosing, trying different dosing, start trying different ways, this dosing regimen, this mixture, these type of things, and I'm still playing with it. I mean, I'm still, I found stuff that works, but I'm still refining all the different regimens and playing around with it and doing so. Also, you do find it changes, like, so for me, when I first started taking it, there was definitely a different as I saw and figured it out, then I put my mom on it, and then, of course, we're seeing the changes in my mom. We measure stuff on her spine, showing that we're regenerating her disc. She's looking younger, she feels younger, she's
she's getting taller, I think, right? And you showed some
yeah,
is worth this.
getting taller,
Great
her
man.
kyphosis.
Yeah.
Yeah,
Amazing.
so amazing stuff. And so then, yeah, so I decided, well, okay, I've got her on this regimen, and then I kept kind of tweaking and playing with it myself and figuring out, different versions. But the one thing I saw is that, like, for her, she could tolerate in some ways to take it almost more than I could. For me, my immune system was younger and stronger, so for me, it kicked in, and that was like strong. I was because she was like, oh, I can take it like 3 days straight, no problem. I was like, "Well, for me, that's intense because you feel your skin getting tight. I mean, you feel like the changes, um, the turnover on your hands, like the skin, will start peeling like faster. It's like becoming like, okay, like, oh, that's a little too fast. It's getting a little sensitive. But you're amazed at the things that you didn't realize that as you got older were changing. Your sensitivity of your skin much
Right.
greater. Obviously my vision, my close vision, had gone. Now it's come back. I can see up close again. I mean, I still
Right.
sometimes need glasses, but before I always needed glasses up
Mm.
close. There's a problem because, like, obviously, like, I did interventional procedures and seeing the needles and stuff like that. I started noticing when I was getting about 46, it just kinda hit me suddenly. And then, when you have some cataract, a little bit cataract formation, because that's what happens, it's like early cataract.
Yeah.
Um, that's fixing. Your hair starts growing like crazy.
Yeah.
You can almost feel your hair growing.
Wow.
It's weird. It's
It's really fascinating, right? And just so the audience understands, this is not a try it at home kind of thing because Jason's looking at this through several sophisticated lenses. One is the dosing of the different components. One is the different components that go into the cocktail. And then the other is, how many days do you take it for before you take a break?
yeah.
One gets big 3 days. And so even in cancer patients, they may take it for a course, let's call it. And then they may stop and do it again, whatever. And he was explaining to me that some of these people 9 months later is when their cancer starts to really go away. So this is a very, sort of black box in terms of exactly how to get it right. So just don't start playing with valproic acid. Okay, right? That's how I.
Yeah. Yeah, no, I mean, obviously, you need help on this, and, I think there's a lot of stuff that we're gonna try, and, obviously, I think together work on this stuff to try to refine and, get this to patients, and, that way we have, like, the better on the dosing and stuff like that, and the regimens, because I think the patients need to be followed, and you 'cause it's not the same. I mean, male patients are different than females. I mean, there's, like,
Explain that to us because we know that men are different than women, but
yeah.
how do they respond differently?
Their cytokines are different on that, and I know a little bit so because, my wife has taken the regimen some,
Okay.
got
Are
the
they you're sensitive, less sensitive,
more sensitive, so my wife is younger, and she's a little bit more slightly autoimmune prone,
Okay.
so it doesn't really generate typical autoimmunity. It's weird because, like, it's like a different type of response. It's more like an innate response. It's not like the full out antibody attack
Mhm.
type of response. But you can see, like, the sensitivity in her, and so you have to adjust the dosing back. I mean, you have to, like,
Right.
keep it less, and so it's variable for many people.
Well, that's an interesting thing because when we think about making the immune system younger, one of the things we think about is actually balancing the immune system, right? In other words, as people have insults or genetic predispositions or, exogenous inflammation or whatever, it can activate autoimmunity where the body's actually now reacting against its own tissues, right?
Right.
And, we can do certain drugs to try to bring that into control or to modulate it back. And then there are things you can do to suppress the immune system. But here we're talking about rebuilding the immune system. So the question is, if you're rebuilding it, does it come back into balance, or is there less tendency for autoimmunity or more tendency, or what's your
That
take?
that's a good question. I'm trying to really figure that out. I'm not sure if we know yet
Yeah,
fully on that. There's definitely gonna be less tendency for diseases that you would normally see of aging
right.
in a degenerative type disease. I mean, so again, like, obviously, like type 2 diabetes, probably coronary disease,
Yeah.
obviously Alzheimer's,
Yep.
Parkinson's, probably all those type of things you would see
Yep.
less propensity stuff. You're gonna see stuff that you would only see. I mean, it makes a person younger, so younger
Mhm.
people don't usually have those problems.
Right.
And whereas younger people certainly can have some autoimmune issues, as well.
Yeah.
But I do think that this, in some way, seems to fix some of these problems. It's strange. You would think that it might would aggravate them, but it actually seems like it makes them better.
I know coming at it from our angle, right, which is kind of the longevity medicine, functional medicine combined therapy, many times we're able to kind of get to the root cause of why somebody has autoimmunity and kind of
Yeah.
fix the stimulants that are kind of triggering the immune system to go that direction, which may be nice when you have people that have a history of autoimmunity or active autoimmunity to kind of include what we're doing to kind of lay that more to rest so you can come forward with the other stuff and not sort of
Yeah.
activate it. Yeah.
I think certainly the gut microbiome, huge
Right.
aspect of it.
Yep.
And so, and it's funny because like for steroids, I mean, we do this in our cancer patients. Like our cancer patients, we do, fecal transplants. We use what's called Reboda. Reboda is a FDA approved for C. diff, obviously off label for cancer, but we use it and it's amazing. We see just using Reboda that patients' cancers will improve because it improves the immune response. And so that was some of the things that when I was doing this and also doing like with my wife as well, I did Reboda. She did Reboda. I mean, we were doing like all the things. So like when we do, there's kind of different ways you can do the protocol. Like, so for me, when I do, I'm doing like the maximum. I'm doing all the different things. Like my mom, she's doing a lot, but maybe slightly less level. And then we have a few other people who are doing parts of it and they're doing even less and they see improvement, but to a much lower level.
Got it. Yeah. So it is probably dose dependent to some extent. Well, I'm excited to jump in on this with you. We're excited to
Yeah.
work with you on it and test and see what we could do. But Jason, it's amazing work you're doing. I think the audience has probably found this conversation fascinating, quite honestly. So think of it this way, two of the things that you're most dreading in life, getting old and potentially getting cancer, you're kind of hitting two birds with one stone here, right? And so, and even heart disease and dementia and some other things, right? So the whole degenerative side of this, yeah.
It's amazing. I mean, I think, in the future, what we're going to see is a few things. One, we're going to see a population where everybody's in a younger state. Everybody's, you know, basically between the age of 25 to 40.
Yeah.
Yeah. You'd want to stay in the age where your risk of death is less. I mean, so
That's right.
staying in that realm. And, so then you can see a lot less of other main problems like diabetes, heart disease, things like that. I think the future for cancer treatment, well, one with this, I think we'll see a lot less incidence of cancer because we're going to keep people young. So
Right.
the cancer incidence will go down. And the other is that in the future for cancer is that we know we should not be like really like cutting on these cancers, disturbing them too much. I mean, even biopsy, if you're going to, for me, if you're going to biopsy, you need to treat. So if I identify a person, you say, this person highly suspicious for cancer, let's go in. We can sample it then, but we're going to go ahead and treat. We're not going to biopsy and then, come back 2-3 weeks later.
Right.
And now we've inflamed your cancer.
Right.
And so now your risk of metastatic disease is higher. So,
Right.
that we're doing it wrong. I mean, we need to change how we do this.
Well, I think it's really enlightening. I think there is a new paradigm of medicine coming for sure, and I think we are really going to be able to live young for a lifetime, leveraging technologies like this. So, really, again, congratulations on all you're doing. It's such a pleasure to have this conversation with you, Jason. Thanks so much.
Thank you. I appreciate it. It was good talking with you.
Yeah.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks. Real talks from real doctors on the issues that matter to you most.